Okay, so I'm on call tonight, but during the day I was on ultrasound. And we had a patient that we scanned who was 49 years old, 20 weeks pregnant. She had no idea she was pregnant until she recently had a trip to the ER and found out. She thought she was menopausal and she got pregnant. So let's talk about perimenopausal and postmenopausal pregnancy. So perimenopause is also known as the menopausal transition, and it can last for several months to years, leading up to true menopause, which occurs after 12 months of no menstrual cycles. Now, the menopausal transition or perimenopausal period typically starts when someone is in their 40s, and it can last anywhere between 7 to 14 years, but that can vary widely from individual to individual. And menopause, on average, occurs by age 51. Now, someone who is truly menopausal, no periods for 12 plus months, cannot get pregnant on their own. They would need to use IVF to become pregnant if they chose to do so. In the perimenopausal period, however, although fertility is reduced, pregnancy can still happen. And that's because during this period of time, the periods, menstrual cycles are irregular and ovulation can still occur. And these irregular periods may mean that the length of a menstrual cycle is shorter, or the time in between menstrual cycles is longer, or a combination of the two. Now, data has shown that 75% of spontaneous pregnancies in individuals over age 40 are unplanned because they just think they can't get pregnant, or they're in that perimenopausal period with irregular menstrual cycles. But it's important for people to know that during that perimenopausal period, even though pregnancy is very unlikely, it can still happen. So if you don't desire pregnancy, you need to take steps to prevent pregnancy until you are actually in true menopause. So for my patient, she had been several months without a period. And before that, she was having irregular periods. So she just thought she was in menopause, but she was actually pregnant. And she had never really went a full 12 months without any periods. Now, although some people do spontaneously conceive or get pregnant in their late 40s or even in the perimenopausal period, I don't want people to think that they can delay childbearing and that it will happen for them as well, because it probably won't. In fact, ASRM says that fertility declines or even ends on average 5 to 10 years before menopause occurs. So like I always say, if you are anticipating delaying childbearing for any reason until your mid to late 30s and beyond, please see a reproductive endocrinology and infertility specialist to have a conversation with them. They can ask you some questions, get some baseline lab work, talk to you about what your future plans are for conceiving, and give you some great advice.